and I'm pleased to see all of you back here for a very important conversation about policy as it affects community schools. Policy in our community schools world is not the easiest road to navigate. We spend a good bit of time at the federal level trying to encourage the Department of Education, the Department of Health and Human Services, the Department of Justice, the Department of Agriculture, the Department of Labor to find ways to encourage, to create incentives for people to work together at the local level. And we've been doing the same at the state level. And, you know, we wanted to bring you a group of state-level policymakers from here in California who could not only share some of what's going on in California, but could offer people from around the country a window onto how to think about state policy, how to interact with your legislators, and how to encourage your state to use the community school as a vehicle for bringing together the different streams of activity that they're now implementing to help schools, families, and communities. I was in Connecticut recently, and I can tell you, there you go. And Connecticut had a summit on community schools convened, Tom, by your colleague Stephen Pryor, who's the new Commissioner of Education. And he had with him at that event the Commissioner of Social Services, the Commissioner of Public Health, the Commissioner of Workforce Development. The Commissioner of Workforce Development, I thought, was particularly eloquent when he said that we have to stop educating our children as though they are robots. We have to educate them to build robots. And that theme of really trying to be more creative, more entrepreneurial, and creating more opportunities for young people ran through that conversation. So in Connecticut, in Illinois, in New Mexico, beginning in Ohio, you know, and here in California, we're beginning to see much more attention to the role that states can play. And it's a challenging question. And so we've brought together 4 people with a wonderful moderator whom I'd like to introduce. Our panelists include Tom Torlakson, who is the Chief State School Officer of the state of California, has been in that role for a couple of years now, if I'm not mistaken, and has had a long history of work in education. We have 2 state senators, Loni Hancock, who was formerly, I believe, a regional director for the Department of Education, and has been involved in education policy and strategy and schooling services and integrated services efforts for quite a long time. We have Senator Mark DeSaulnier, who has been a great advocate for summer learning, which is a very important piece of what we need to do for young people. And we have Tony Iton, who is the Senior Vice President for Healthy Communities at the California Endowment. We're grateful to the endowment's support for this event today. Tony works hard to get communities to pay attention to public health issues and confront the tough issues of race, of class, and that are necessary in order to really create healthy families, healthy communities, and we know so well how closely connected these issues all are. We've asked Jennifer Peck to moderate. Jennifer is the Executive Director of the Partnership for Children and Youth. They are one of our closest partners in the state of California and have played a pivotal role in beginning to develop the community schools movement and bring networks of organizations together here in California. You can see in your program that we've had support for this event and help in reaching out from the California School Boards Association, from the Association of California School Administrators, I have to get that one right, from the Association for the Education of Young Children, from the Institute for Local Government, which brings together cities and counties and school boards to talk about the well-being of our children and our families. So Jennifer's done a wonderful job in moving that agenda forward, and I'm going to turn the program over to her. Thank you, Jennifer.
Is this on? Ooh, it's on. Thank you, Marty. My organization is really proud to be a part of this movement and to be partnering with the coalition, and we are really grateful for the coalition for bringing this huge and very diverse group of people from around the country and from other countries as well here to California. I think we have a lot of exciting things to talk about that we're doing here. And we're going to do our best during this panel to try to provide some creative ideas and thinking about what can be done from the state level to try to enable and encourage more community schools in the places where you're from around the country. It is very humbling to be on the stage with this group of leaders, some of whom I've known a very long time, are some of my favorite people to work with. All of them care very much about the concept of community schools, and all are looking for ways to do more. So we are really lucky to have them here today, and I'm really hoping that during the question and discussion period of this a little bit later, that people are going to speak up and offer some of your own ideas and thoughts to inform the conversation. So we have a couple of goals for this session. First, as I said, is to have a really rich conversation about what is possible from the state level to inform your thinking and your work when you go back home from here. My other, which is the more selfish goal for myself and my fellow Californians who are here and the other advocates who are here, is that the folks up on this stage get really excited about some of the things that we talk about and get some creative ideas that we can follow up on when we leave here today that are very, very concrete. So we're going to start with some opening remarks from each of the panelists for just a few minutes so they can tell you a little bit about why they care about this, why they took the time to be here today. And then I'm going to throw out some questions to them. And I have asked the panelists to feel free to respond or to add to or even challenge something that their colleague might have suggested. And then we're going to leave about 15 minutes at the end for questions and comments from all of you. So I'm going to actually start down on that end with Senator DeSaulnier.
Gotcha.
I'm delighted to be here. I want to tell you all that for people who aren't from the Bay Area, it's not like this outside usually at this time of the year. All of us are from the East Bay, so it's nice to come into San Francisco on a beautiful day like today. And I will say, Senator Hancock and I know we are from other parts of the country. I grew up in Massachusetts. Anyone from Massachusetts here? People from Massachusetts are usually louder than that. Yeah, that's better. And actually, my interest in these types of issues started when I was in Massachusetts. I had a job at the Boston Juvenile Court. I was from an affluent suburb. My dad was a judge, and all of a sudden I was in a court which dealt mostly with young people of color from Roxbury. And it left an impression on me all of my life. So that I went into politics. It was something I wanted to work on, is how do you help kids from a lower income who are in more challenged positions. So it's sort of been, when I was a county supervisor with Tom, we partnered on things at Juvenile Hall, trying to do creative things. So it's always been an interest, and the legislature has been wonderful working with Jennifer, Tom, and Loni to try to find creative ways in a very, very difficult economic environment. I chair one of our budget subcommittees on Health and Human Services. Senator Hancock does corrections, so we work a lot together. But Monday, in the state of California's Constitution, there's a requirement for the governor to do an update on how our tax season was. We have about a $10 billion shortfall here in California. That's better than last year. We had a $26 billion shortfall, and before that it was $44 billion. So you would think we're getting better, but actually we're cutting so to the bone. I think for me, this has been the toughest year to go through these hearings. And then on Monday, we're anticipating, we got a little bump last year as the economy started to increase, particularly from companies like Google and Facebook that were doing so well and still are. But this year, for some reason that no one really knows, our tax receipts are down. So we're anticipating another $4 billion. So to try to do these innovative things, one would think this is an impossible time to do it. I would argue this is probably the best opportunity to do it, to do more collaborations, to try to get people to be more efficient and effective with services, to get school districts to work with one another and with cities and with special districts in California, and for the state and the counties to work better as well. So we're trying to do innovative things. We're trying to support, in my budget subcommittee, we're trying to find ways as we move toward national health care, and Tony can speak to this with more expertise, how can we do more to incentivize clinics in schools, which when we were back in New York some time ago, we had a wonderful tour of a school in New York. So those kind of things, can we help with healthcare reform to give the kind of services that kids need in their school, in clinics that have behavioral sciences and treatment in them as well. So In spite of the dire circumstances, I think this is an opportunity, particularly, well, in all the states that are having trouble, to be really innovative.
Jennifer? How's mine doing?
It works.
Better, good. I don't have to use this. Well, hello, everybody. Mark and I, and actually Jennifer and Tom, we were all back last year, right, for the national conference that you had in New York, and it was an inspiring and wonderful time for us. You know, I got involved in this issue about 20 years ago as the mayor of a middle-sized city in the East Bay, realizing that at that particular time, we were worried about our kids, and we were actually kind of scared of our kids, the young people, and thinking that as a city, we didn't do much for them. We had a recreation program once in a while of varying qualities, and we policed them. But we didn't talk to the schools either. So we began an exploration of what we might do for these kids to bring them into the community. And that led to one of the first high school health clinics that later became federally funded. And you know, what I think right now is so critical is that as we move into the federal health care plan, our high school or school-based health clinics become an integral part of the funded plans that every state develops. Because I remember the school nurse who said to me, yeah, they come in for a hangnail, and then they tell you what's really the problem. And the fact that a school is an easy access, you don't have to ask anybody's permission, and if you're uninsured, the door's always open, can't be overstated. We started a biotech academy in our high school with Bayer Chemical, which is one of our largest employers, and watched that turn teachers' lives around because teaching a child or a young person something related to what might be a real career for them that has a paid internship with a business partner during the summer and after school, all of a sudden you become an engaged learner. And that was so important and led to work that we did later together on what we called School to Career during the Clinton years. And for those of you with colleges around, we also did something called the Real Alternative Project, which was for at-risk kids, very at-risk kids at the high school, with college students, mentoring them and brokering services in the community. It turned out to be a remarkable thing for the kids because they could really identify with the college students who are just a little bit older. And some of those college students are still doing youth development work in Oakland, Berkeley, Richmond, and I run into them around. So that almost got me ready for Clinton, Riley, and the experience of thinking about every child should arrive in school ready to learn. And what does that mean about food, about dental care so you're not in pain? What does that mean about being able to see the chalkboard and hear the teacher? And how do we make sure that those things are available? How do we continue the spectrum of community partnerships in every way? And I believe that we have to go there, and I agree very much with Mark Desaulniers. Now is the time, because when we do this, we make every dollar do double work. And that's what we need to be thinking about in hard times like this. And I'm just very pleased to be here to think with you about how we get that to happen. Tony?
Me? Okay, well, good afternoon. And I really feel sorry for those of you in the back. This room is enormous, and there's plenty of space up here for you, and there's candy and healthy sodas up here for you. Not true. So I'm asking myself, how did I get on a panel with three politicians? And realizing that my only experience in politics really was getting elected president in college and almost getting impeached for radical ideas. So I'm going to put out a challenge to us all, and this is really kind of present company accepted, because these are some of the most exceptional leaders that I know in the East Bay and throughout the state. But I don't think that our leadership in terms of how we actually support our children is good. I think our leadership is lacking. And I think beyond that, we're lacking critical thinking skills around how we design the kind of supportive structures that all communities need. Now, I want to put out a shout out to the Connecticut folks, because I learned sort of my whatever limited skills I have in this arena in Stamford, Connecticut, when I was the director of health there 15 or so years ago. And the East Coast in general has a better kind of scale for dealing with some of these issues of collaboration and integration. In Stamford, as I said, I ran the health department, and there were 20,000 kids in the school system, and we had 28 school nurses in that school system. And when I got to California, Oakland, and Alameda County, we had some 100,000+ kids in the various school systems in Alameda County, and we had 14 school nurses. And the first thing I thought was, well, this is absurd. You know, we should partner with our school districts and perhaps bring some of the public health department nursing resources into the school system. So we tried to do that. We started with Oakland, and we ran into all kinds of resistance, not so much from the nurses, but from the systems. The systems just didn't really want to talk to each other. First of all, there were very different pension systems, different union systems, and there wasn't a sort of a culture of you know, deep integrated work. So I started saying things like, you know, I'll give, my budget was about $100 million, and I said, I will give half of my budget to anybody who can guarantee 100% high school graduation in the city of Oakland. And it was not a generous offer. And the reason was that I wouldn't need half my budget if we had 100% high school graduation in the city of Oakland. And so what that lesson sort of taught me was that we need to find ways, and very stable, permanent, ongoing ways to foster collaboration across these various silos. I want to tell you just a quick piece of data. I usually walk around with a lot of slides. I'm known for, you know, being a data junkie. But one of the things that we did when we got to Alameda County, it's about 1.5 million people, with a whole bunch of sort of service regimes and social services, probation, schools, school health, health services, public health. We wanted to find out how people were spending their money. So we took all of the data in the public health department, the probation department, we talked to the state parole agency, and to the social services agency, and we actually put this all into a map, into a geographic information systems map. And we found that in a couple of our high-need communities, that we were spending just between those 4 agencies, again, public health, probation, parole, and social services, we were spending about $6,000 per household in our high-need communities. So that didn't include health care, it didn't include education, it didn't include police services, and a whole host of other services. And we recognized that with that $6,000 per household, if we had a blank piece of paper and that amount of money per household for these communities, this is not the way we would have spent that money. We would have found a way to collaboratively invest that money in ways that would actually have double, triple, and quadruple bottom line returns. But because of the siloization and all of this parallel expertise, literally people were going to the same door, lining up outside the door and saying, I'm from the health department, I'm here to help you. I'm from probation, I'm here to do whatever. And you can imagine the rest. So this is why I say our leadership is not good. And our critical thinking skills are even worse. We're smarter than the systems we've designed. We can do a lot better job in actually integrating the systems. And these models for community schools are beautiful models for creating that kind of template for integrating services and holding all of these various silos accountable for the outcomes that matter in community.
Tom.
Great. Great. Likewise, great to be here with my good friends. We worked for years. We sort of get it because we've been working at city level, county level. I was a teacher in Title I community, working at the statewide level. Tony, you appropriately put out the challenge for us to take what we know works and what we see works in other places, and the challenge of how to make it even better and how to make it more replicable. How do we actually break down those barriers and silos? And so this is all about coalition, partnering. I call it teamwork. The team theme, I was a high school track and cross country coach for about 25 years, and the team theme is TEAM, together everyone accomplishes more. Mark, even you remember that. and it's so true. But it isn't easy, and it takes good coaches, as Tony was underscoring. It takes good leadership, but it takes good examples. And you know, we're all in a crazy time of budget crisis. We can't be paralyzed by that. We can't sit on our hands because of that. We can't wring our hands because of that. We really need to rethink and relook at our systems, because it's imperative that we do provide that smarter, better coordinated, integrated set of services, because it makes economic sense, and it makes health sense, and it makes moral sense, and it's the right direction to be going. So, you know, as I had my experience teaching high school in a Title I community, I saw, you know, my students weren't isolated just there during the day, and that was their whole life. They had a whole host of issues and a host of needs that had to be addressed outside of what we could do at the school. And there's where we got into getting healthcare connected to the school, social services connected to the school. So I see myself in the places in California and other parts of the country where you've put community schools into place. I see, you know, bright light. I see change happening in the right way, and a pathway to the future. I want to point out a couple of things that we've produced in the Department of Education since I've taken over here in California, but we have a blueprint for great schools, which is available on our CDE website. And one of its key tenets, besides 21st century learning and how to get the best teachers in front of all of our students, a key premise here is we need to teach, reach and teach the whole child. And that's what community schools are all about. It's looking at the reality, the daunting challenges. In California, 1 out of every 4 of our children are growing up in poverty. 1 out of every 4 of our children, soon to be 1 out of every 3 of our children, are English learners. Healthcare, 1 out of every 4 of our children have health care, and the rest do not. We have a huge problem. It was 1 million students in California without health care just 4 years ago. Now it's 1.5 million students because of what the recession's done to their parents' ability to get health care. But reaching and teaching the whole child and figuring out strategies that deal with all the needs of the child and the family, and how to bring them together in a school setting where it's most effective, I believe, and where parents are more trusting. And that brings me to the second part of our work product. We've put a family engagement framework together, also on our CDE website, which talks about the key role of parents. And there are parents who are so busy working and so tired after the long commute and the long workday, but there's still ways to reach them. And there are parents that need a little coaching and need a little guidance, and they'll get involved in figuring out the right strategy. But the family engagement framework is a key part of our work product. One other thing we're really focusing on is chronic absenteeism. If the student's not there, they can't learn if they're not there in the classroom. And so we see high rates of chronic absenteeism, as much as 20% in Los Angeles and Oakland schools, where kindergartens are absent 18 to 20%. And so they can't learn if they're not there. And many times the reason they're not there is there's a social service need in that family. There's a health need in that family. And when we have a coordinated kind of program like you have in community schools, we sort of look at the challenges beyond just running down the student and saying this is an attendance problem. This is a community problem, a community challenge and opportunity to serve that family better. And so I look forward to your questions on this. I'll just end by saying one example is Rosa Parks Elementary School in San Diego. I've had the chance to visit it a couple of times. They have a parent center where it's sort of owned and run by the parents, where it's a welcoming place for parents to come and organize what they can do to help their students learn to read, get the good meals they need, get the good health care they need. They have a social worker on campus, and they have a school-based health clinic. And that whole integration has changed that school, and that community is so well served. Those students are soaring academically because they have all these supports integrated. So look forward to the tough questions Jennifer's going to throw at us.
Thank you, Tom. So I'm going to go back to a theme that Tony raised in his opening remarks about the challenge of the systems at the local level talking to each other and working together that I know everybody here has encountered. And everybody on this stage has worked in local government at the city level, at the county level. And this is a bit of a broad question, but I want you to think as creatively as you can about it. I'm going to open it up to a volunteer to start, but I'd like all of you to comment on it. What can we do through policy at the state level and through leadership to encourage or incentivize those local systems to work more collaboratively together? And what are some examples of things you've seen that have worked in that regard? Who wants to start?
I'll need a microphone.
Cool.
When I first got elected to City Council, the first problem we had was we had grants for the 4 middle schools in the city that I was on the City Council for, and the school districts wouldn't allow the City Park and Rec Department to have actually let the Park and Rec Department. So, and the issue was liability. So we basically, I owned a restaurant at the time, and the superintendent used to come in for lunch all the time, and I finally told him I would poison him if he didn't work out a deal with us. So that was an innovative way of getting administrators to work together. But it was it struck as me as an example that I've seen over and over again. And sitting on the stage and thinking when Tom and I were together, during the Wilson administration, something started called service integration teams, which I've talked a lot about. And it was just putting the services, if possible, in a school, but always where the clients were, and putting a combination. So the line was the opposite of what Tony explained. The clients would be coming to the school where the probation officer was there, the public health nurse was there, the eligibility workers for both health and social services. The frustrating part is all those grants have gone away, and that's one of our problems is, at least in this state, and I don't know how it is in other states, when times are good, we start these innovative programs. We have a long enough period of time if we're lucky to show that they work. Sometimes multi-generational, we have to take that much time. But then when things get tough, those are sometimes the first things we take away. So it strikes me that if we were to get this right, and when we do get this right now, it's best actually, to, as I said before, to do it when times are tough, but it requires a real force politically, I think, to force those partnerships. Someone mentioned organized labor, which is very powerful. We all have supported them in our careers, but trying to build those collaborations actually sometimes are easier right now because we have been laying people off. So it becomes more of a case of survival if you can work across different labor organizations with different groups. But all of these things, I think, are really a challenge. The one thing I will say, between our trip and then when I came back, going to 2 clinics in schools when I came back, was just sort of the gestalt of seeing these kids who were advising these clinics in Hercules and Pittsburgh, and the tremendous energy, that the sum was truly greater than equal to the parts. And once they got in these schools, it was really hard to remove them because there was so much ownership from the community. So there's nothing simple about this, I don't think. I think there's just an opportunity and a tenacity that's required of all of us to stick with it.
I'll try to. Oh, I've got a microphone.
I'm the only one with a bum microphone.
Yeah, just to add to that, Jennifer and I were talking the other day that Healthy Start in California, which was something that also required, it was a little bit of planning money, and then collaborations were supposed to happen, and they did, and we have data now showing that those programs worked. However, they were cut in hard times, and apparently we have data that shows that, you might want to talk about this, Jen, that the ones that really did a lot of collaborative work at the grassroots level are still continuing. They're finding ways to continue. So how do you get that bottoms-up leadership? But then the other thing I was going to say is, and how do you get the top-down leadership? I used to be very frustrated in going to partnership building meetings around the region when I headed up the regional office of the U.S. Department of Education. And we had a lot of partnership building money. You would go, and if it was a non-school event, somehow nobody had remembered to invite the schools. And you'd have to say, excuse me, we're dealing with teenagers, we're dealing with kids, young children, where are the schools? And then I would find that you'd come back later and the school superintendent or somebody would have appointed somebody 3 layers down in the bureaucracy who basically sat behind the decision makers and never said anything. Now, somehow you got to have the superintendent there with the head of the health department, with the others, and we need to find ways to insist that those are the people, and then that they also let go and empower the people that will stick with it and make it happen.
And if I could add on to that, the question of leadership, which Tony raised, is very important. So it's obviously supporting at every level, school board races, city council, your county supervisors, commissioners, individuals, supporting them with checking with them, either educating them if they don't know about it, or if they are aware of community schools and the value of integrated services, getting behind them and helping them. Because that leadership will see opportunities once they're in place, the elected leadership and those they appoint to help. I'll give an example. A lot of what I did when I campaigned for the office of superintendent to represent 6 million kids here in California is I talked about my experience as a city council member, my experience as a member of the Board of Supervisors, seeing no community library, but seeing a library that was locked every day at 3 o'clock. The school library was locked and it had $1 million of books and academic resources, but it was locked. And it took months of negotiation between the school librarian, who didn't want anybody else in her bookshelves or in her chairs, but we ended up bringing it at 3 o'clock. The county librarian came in and ran that as a community library and had adult literacy classes and had Saturday homework and awesome programs for the community. But that was just an opportunity that came. Another one recently, just to give an example, and you all have some of these examples locally, but I did talk to the head of ag in California, the obesity diabetes epidemic, the health challenges of our students. So I talked to Karen Ross, who's Department of Ag. I talked to Diane Dooley, who's Secretary for Health and Human Services. And we got our departments working together and saying, how can we address? We have common values, common goals, but we're in our silos, just like you said. Well, what we decided to do, to talk to the farmers about how to get more fresh fruits and vegetables to our school lunch and breakfast programs, how can we most effectively do that? If I sent out a Department of Ed bureaucrat or health sent out a bureaucrat and talked to farmers, that wouldn't work. So the 3 of us got together, my department and social services, and co-funded a position in the ag department that's now working with farmers to get more fresh fruits and vegetables into the schools. We're doing the same thing with chronic absenteeism, working with the parent organizations that are most effective with their Latino parent population, or African American population, or Vietnamese or Cambodian population. How do we most effectively reach those parents? And then we also are teaming up with Kamala Harris, who's the Attorney General for California, and the local district attorneys to have a soft approach to first about engaging the parents about their responsibility and the need to have the child come to school to learn, and the foundation that's so strong and important in kindergarten. But after that, there's also some legal issues, and getting the district attorneys involved has helped in many districts turn it around. So those are collaborative efforts that I think come from helping get people elected and appointed who see that point of view. Finally, foundations like the California Endowment have been essential in providing the planning money. The first thing to go, unfortunately, in an economic crisis are professional development days in schools, planning workshops and days. Conferences like this have been cut back so much because of the funding crisis. And the foundations that have invested in planning really have made a difference.
Yeah, I agree with everything that's been said. I mean, I think to make it a little less California specific, collaboration is hard. I mean, there's no question about it. It's hard. I mean, people would rather kind of do what they have control over than, sort of engage with people that they don't necessarily know that well and don't necessarily trust that well, because they want to accomplish something and they don't want to, be at risk of essentially failing due to somebody else's lack of effort or lack of, capacity or competence. And so, we have to create structures that allow people comfortably to collaborate, across these silos. And that requires some investment. Mind you, not a lot of investment. When I was the public health director in Alameda County, I used to be very frustrated. There was no table where I would routinely sit with the superintendent of schools. There was no table where I'd routinely sit with the mayor. There was no table where I'd routinely sit with the planning director. So I had to create these opportunities to sort of collaborate with them. And that takes a lot of energy. And if you're trying to schedule meetings, and these are very busy people, and they cancel meetings, you think, oh God, is this worth it? Or they, they don't show up to the meeting, and they send, as Senator Hancock says, some junior person who's just there with like a notepad saying, okay, tell me what to, transmit to the superintendent. Then it's like, well, this is kind of a waste of time. So when we put together our Building Healthy Communities initiative, and I know most of you don't know what that is, but it's basically the California Endowment is investing $1 billion over the next 10 years in California to try to foster transformative change in 14 low-income communities so that essentially children and families can be healthier. And we believe that we can do that more effectively by using essentially investments in prevention, collaboration, innovation than we can in just paying for health care. So part of our strategy was, when we looked at our 14 communities, we realized that there was this sort of collaborative inefficacy, the difficulty that people had actually working across their silos. So we consciously structured this thing we call the hub. And the hub is really kind of, I like to facetiously refer to it as a place where we bring the butcher, the baker, and the candlestick maker together and tell them to make a cake. But what it is essentially it's a table that's staffed and funded that allow people in an ongoing way to form human relationships and to find common purpose across their variety, their very areas of specialization. And when we thought about putting this together, we thought, well, this just makes practical sense. But the reality is there aren't a lot of hubs in our communities. There's these ad hoc things that spring up when you have some good leadership, or you have a funder that throws some money at it. But then, when that goes away, or the leadership moves on to the Senate or to, what have you, a lot of that tends to fall apart. I think that the example of Healthy Start is a very good example, because there you had leadership, sort of at the frontline level, where people realized that this was important. They had the opportunity to forge those human relationships, and they maintained those relationships because they saw how effective it was to work together than it was to work apart. So I think some of the lessons here are about how do we create the vehicles for people to form those natural human relationships, which are ultimately the source of the power that drives change in community.
If I could just add to that, I thought while you were just speaking, Tony, a lot of it is policy. We started a whole food policy in Berkeley, Oakland, many other school districts have it now, about how to get children nourished, knowing that a hungry child can't learn in many profound ways, not only the hunger, but actually some of the studies have shown that if you're malnourished, the synapses in the brain don't allow attentions to be focused in quite the same way. But during all the turmoil that led to that, the school superintendent kept saying quietly, tell me to write a policy. Tell me to bring you a policy. And we did, and he did. And I have never forgotten that. Is there a policy in each one of the districts and at the state level that says collaboration? Every school should be a community school. We can't afford anything less at this point in time. Mm-hmm. And then you can empower the other people. Then the superintendent and the mayor and everybody might not have to be there, because there are so many brilliant young people and people who've come up through the ranks of organizations, if you say there's a policy, it's going to happen, go do it. And the planning money for Healthy Start was so important because of that. And that was really, as I think about it, what Goals 2000 was about. Every child in America should arrive in school ready to learn, said Secretary Riley. And we all went out and started to try to think about what that meant and how we could get that to happen. So maybe you guys, we could think of something to do at the state level on this. I don't know.
So I'm going to build on some of the excitement we're hearing about Healthy Start and this concept of building that table at which the leaders talk and the systems talk at the local level, and the 14 communities that are receiving investment from the endowment are getting an infusion of resources for that kind of planning and coordination. But that is the real sticking point and challenge in a lot of places in getting these kinds of initiatives started and moving forward. We did have that kind of investment for a number of years in California, and as Senator Hancock alluded to, it can be deemed a success. There was a study that we co-published with UC Davis last year documenting Healthy Start grantees that had survived for 20 years beyond the life of their seed funding because they did such a good job of putting the coordination and the systems in place and have off the charts leveraging ratios of what they put into their planning and coordination and what they're getting back in other services they've been able to bring to bear on that. So this seems to me a really smart investment states can make. I heard Marty say earlier that I think Connecticut is doing something like this at the state level, some local community school coordination and planning dollars. My question to you, Tom, and to our two senators who are dealing with the budget crisis in a big way is, what do you see as the possibilities for this happening in the foreseeable future? And what are the messages or the arguments you think are going to be necessary to see this kind of investment come to bear?
What are the opportunities in the near future? And you know, the Healthy Starts is a great example of something that worked. It was an era when there was more money in the budgets and money was smartly set aside for that. When we all served on boards of supervisors or city councils, if you could make a case that by investing, you know, $100,000 here, you're going to save $200,000 in avoided costs. The shorter turnaround you could show that, you know, that investment return, the better. If it was a 3-year turnaround, that's better than a 7-year or 10-year turnaround. So some of those arguments are needed in the midst of this, you know, fiscal crisis. Not to belabor, but you know, our child care programs in California have been cut back 42%, about $1 billion of cuts to child care. We've lost $20 billion in our schools, 1/4 of the funding of our schools. So a lot of organizations have been operating on crisis mode. That's again where I think it's important to have the connections to organizations that will help seed fund some of these efforts. I think legislation is smart. I think you could build a case and you could get some very progressive legislators like are sitting right here, and I would sponsor and support legislation with them to recreate a Healthy Start type of grant program. But it might need to be on a match basis, probably a stronger thing than that the state's going to fund it all. No, if the city's going to step up and fund, you know, 20%, and a community-based organizations fund 20%, and you put a package together, it's more likely to get traction in Sacramento in the midst of tight budgets or in other state capitals around the country. So I do believe that planning money is critical, is catalytical, really important to get people to relate as human beings and then set common goals. In the meantime, what you can do again is advocate in each agency to find the people in that agency who are willing to step out of the whirlwind of their daily activity and link arms with someone else, link minds with someone else from another agency to solve a common problem. And I think that's in the short term more of what we'll need to see done and have accomplished. And then in the long term, we should go for federal legislation and state legislation that would seed fund in a broader way these kind of integrated service plans.
Loni and Mark, you want to comment on that?
Well, I think we need to look for incentives and formulas that have incentives, you know? As money comes up, how do we incentivize the partnerships without penalizing the most stressed systems? Again, when we started working on after-school programs because during the Clinton years, and we did a little survey in California, and we found that the most needy schools weren't applying for the money. So we did a survey of why. Sent it out, called the principals to follow up. Some of them said things like, look, lady, I'm out there stopping fights in the hall, and you're asking me to put together a collaborative partnership with everybody in the community. I don't have the time, I don't have the resources. And we were able then to get a little foundation money to some of the intermediary organizations that went out and worked with those districts so that they could do successful applications, and then also try to keep helping them so that they could run for successful programs. And I'm looking at how we give respect to the intermediary organizations that can be so helpful, how we write formulas at the state level that give money to communities to plan and incentives to collaborate. And I think that would go a long way. And we're working on, I do a lot with prisons and juvenile justice. I chair the Public Safety Policy Committee and the Budget Committee on Prisons and Courts. We're trying to get the money out of that system and into the education system again. But yeah, right there. But one of the things we're finding is that there's been some formulas that are inadvertently written to reward punitive alternatives as opposed to more restorative and rehabilitative alternatives. And I think we have to look at those. Finally, I just wanted to say, I was going to say to the California people and as a warning to the rest of the country, the difference between Connecticut and California, Connecticut has about twice as much allocation per child in their public schools every year as California. I believe it's something roughly like 12,000 per child to 6,000 something per child. And that is wrong. And one of the reasons we have it in California is that unlike probably Connecticut and unlike everything but only 8 other states in the country, we require a 2/3 vote to raise any taxes or any fees or close a tax loophole that was previously enacted or even hold an election on whether or not people should be allowed to vote on taxes. And that is why our revenue situation is so bad. Don't go there, rest of the country. Change it. Help us change it, California people. Because otherwise, Connecticut will be a model and they will be out in front and they will be doing things that we just aren't able to do here.
My warning would, don't emulate the California initiative system, because that's what helped create what Senator Hancock just talked about. I think the opportunities are, and maybe Tony can talk about this a little bit, as each state prepares for healthcare reform, one of the hopes is that we'll get savings when we start to reach the bend in the curve, and we'll do more wellness programs, prevention and intervention. As Tom said, the challenge in childhood obesity and related diseases, diabetes. We know that, as Loni said, if we get kids eating good food when they're young, they're going to continue to do that the rest of their lives, and they'll do exercise for the rest of their lives. They're more likely. So there's that opportunity. For me, I've always had this hope, and San Francisco some years ago actually put a percentage of their total budget in the city just for kids programs. Oakland did it too. I've always wanted to do a reinvestment percentage in the California state budget. And we do ballot box budgeting because of the initiative system. So I hesitate to do it, but on the other hand, as Loni, and Loni's really fun to watch with all these big correctional officers. They're scared to death of her because she controls their budget. I used to have that committee, and they weren't scared of me at all, but they're scared of her. The Department of Corrections in California is a perfect sort of example of how we spend money on crisis and poor outcomes And we should be spending it upstream on intervention and prevention. So I've always had this dream, and I'm going to try to do it before I'm termed out, is can we take a percentage of the budget and put it in intervention and prevention, mostly to grants, to community-based organizations and local government, with as many strings not attached based on outcomes, and then just keep reinvesting so you get better outcomes over generations. And some communities have been able to do that, but then we've never, one of the problems with really good programs, at least in this state, and I think everyone sort of alluded to this, you get a really good program or grant, but you never get it to be sustainable. It's hard to get it to be sustainable for 20 years. And then when you know it's working, it's really hard to bring it to scale. So doing those things that really are transformative on a big scale, I think are real big challenges without an identified funding source and breaking down as many strings attached to it as possible.
So I have a question I'm going to throw to you, Tony, but others are welcome to comment on this as well. It's kind of a two-part question, but interrelated. What level and type of evidence, data, evaluation, otherwise, do you think that we'll need to convince people who are not yet convinced that a community school approach makes sense? And within that, how important is the language that we use, given that many people don't automatically know when we're talking about, when we say community schools, they think we're talking about a program rather than a way of doing business?
Yeah, so first of all, I like that question. The evidence issue is always very interesting to me because I have a background in science and medicine and the like, and what I've learned in the career of sort of public policy is that the things that convince scientists are not the same things that convince policymakers and lay people. And so we have moved in our work at the California Endowment to, in essence, a deeper investment in telling stories, because that's pretty much how people learn. They learn from kind of stories with which they can empathize. And then you sort of support those with data. And I think that there are great stories in community schools, stories of transformation of school systems that are very inspiring. And I think that there is, the one nice thing about schools is there's no constituency that's anti-school. There's nobody out there saying, damn it, the graduation rate's too high. We got to bring that down. And so, there's an opportunity there to essentially leverage that goodwill around those stories. So that would be the first part of the question. The second part, again, was what?
About the language of community schools.
Yes, yeah. So I'm notorious for saying I hate the term full-service community schools because it seems like it's trying to medicalize something that, has, to this date, has avoided that kind of horrible servicization. And we need to change the narrative in this work and come up with a more compelling kind of affirmative narrative that describes essentially the vision that most of us share about what school systems should be and how critical a piece of infrastructure they are to healthy and thriving communities. So I think that there's probably some work to do around the language around community schools. It's better than full-service community schools because everybody thinks, well, what services are we talking about? Sounds expensive, sounds, high-tech. So I do think that we've learned there are 5 things that make this work move forward. One is that you have to build the power of the people that are essentially impacted by these failing systems. You have to invest in building social, political, and economic power in those people so that they can more effectively participate in the decision-making that so impacts their lives. We have to invest in leadership, particularly youth leadership, around these issues because there's never been a revolution in the history of mankind that wasn't led by youth. The third thing we have to do is that we have to impact the ability of people to collaborate, which is what I was talking about earlier, this collaborative efficacy or creating real spaces for people to work together across their silos. The fourth thing we have to do is we have to bring strange bedfellows into this conversation. We have to, we're working to bring the private sector into grocery store development in low-income communities. And amazingly, one of the things that we learned, and I personally learned, is that money loves money. So if you can actually, put your investment down first, there are all kinds of people with money who are willing to put their investment on top of yours if you're taking more risk than they are. And the fifth thing is that you have to change the narrative. This can't just be about bad kids. This can't just be about black and brown kids. This can't just be about thugs and hoodlums and, what do they used to call those kids, those predator kids or super predator kids? We have to change that narrative and understand that we're talking about an investment that impacts us all, and be able to tell a compelling story that enlists people's willingness to participate in the solution.
Thank you. I'm going to pose one more question related to data, and then I think we're at our time for questions. This one is for you, Tom. There's a growing awareness around the country about chronic absence as an early indicator for high school dropout, and that's largely thanks to our own Californian, Hetty Chang, who's out there somewhere. Many community schools believe that chronic absence data can inform their work by helping them understand which schools need more partners to help address student and family needs. And the data can also help them evaluate their efforts and how much progress they're making. Beyond looking at student attendance data, what can state departments of ed do to raise awareness about this with districts and community partners and make the information shareable?
Well, as you might have guessed, I am big on dealing with the crisis and the challenges of chronic absenteeism. So it's one of the top priorities of our department. David Copperroot is one of our team leaders, and Hetty Chang is just an awesome leader in terms of being able to inform and share the practices at work to turn it around. And you think about a young person who's chronically absent. That means more than 10% of the time they're not in school. And by the time they're at middle school, they've lost a whole year of education. And it's bought and paid for, the teachers are there, and but the student's not there to take advantage of it. And those students get behind. If they're not proficient in reading because they've been absent, 20% of them in some of the big inner city areas of this country, 20% of the kindergartners are chronically absent by third grade and they're not able to read. They start to get behind in every subject. They start to get frustrated, doubting their abilities, and set up for dropout in 8th or 9th grade and all the tragedies that come from that. So I think it's really important to send the message. This is one of the strongest ways, a concerted effort to reduce chronic absenteeism. It's one of the strongest ways we can close the achievement gap and deal with the dropout rate and drop the dropout rate. So getting the data collected and then getting it reviewed and getting the principal of the school to either personally or with a right hand look at that data. Who's absent? Is it Johnny every Friday, or is it Johnny 2 days a week? Is it Sally? Is it older brother and sister are also absent? What's going on in that family? And then finding ways to intervene. And the school districts that have done this most effectively in California that I'm aware of, look at the data very carefully, the attendance data. Then it's not about excused or not excused absence. It's just, is that child there? And we had recent legislation passed in California to define what chronic absenteeism is. And my department's put together a handbook or a toolkit on the how-to. The good news is that a lot of what you can spend in tracking and identifying the students that need help and then going to their homes, engaging directly with the parents, going to their homes when necessary, that can be paid for, because as the students come back and in the seat or in the classroom, the school gets ADA in California. I think that's true in many of the rest of the states. You get average daily attendance dollars, so that ends up starting to pay for this. So this is one of those programs that can have a real impact and can almost self-fund, but needs some seed fund to get it going. We're discussing a campaign with the thermometer of, we have 1,100 school districts, and we have 11 to 15 that are really doing a super job right now, and sort of getting to the first 100 and celebrating that and honoring the districts that have done it, but basically, and then going to the next and getting up to 1,000, and a regular concerted campaign that will tackle this and get the data out there and the strategies. There's a variety of parent letters you can use to engage the parent at different levels. Again, the parent outreach to ethnic and community groups that will have great impact, and helping carry that message is also very important. So it's a win-win, and I see us going forward in a big way in that in California.
Thank you. So I think we are at our time for questions or comments. If you're sitting in the back and you have one, you're going to really have to yell. Questions, comments? Do we have a microphone going around? I'm not sure. I can't even
the
see.
microphone, right?
If you have a question, stand up. There is. Oh, microphone by the guy with the TV. Somebody must have a question or a comment.
There you go.
There's
Yeah.
somebody.
The manual that you referred to, is that available online?
Yes, it is. The California Department of Education website.
What is the title of that?
It's Chronic Absenteeism Handbook, and it's a toolkit and how-to set of ideas.
How often do all the state superintendents of education get together, and are you leading the campaign on the low chronic absence?
I am working on that, and we get together a couple times a year. I've been more active as a California chief school officer to be engaged and come to those meetings and participate. So I'm very much working on that, and also the summer learning drop-off problem, which our two senators have addressed, and our California endowment have also helped address. But yes, we're trying to organize a national attention to this.
One theory is that we can use results to drive people together, right? So when you push, as you did, Tom, talk about attendance, you are using that as a lever to encourage people to do something. Seems to me that one way that we could encourage this kind of joint action is for the state departments cutting across various agencies to jointly articulate what results are important for California's children. And expect, and these are not things that people aren't already looking at, but to expect that they would report those in their school districts, in their counties, and across the state on a consistent basis, so that people would see what the chronic attendance problem is, so that people would see what the obesity problem is, so that people would see what the school readiness problem looks like, and understand the lack of opportunity for some young children. Is it possible to frame that without necessarily putting resources behind it, because the data is already sitting there in various places?
Yes, that information is powerful, data is important, and obviously having the right translator, the right venue for sharing that information is critically important. We have now in California a CalPAD system was able to track, from grade level to grade level, the progress of the student and have a more rich and comprehensive set of information around that student's background and success as they move along. So that's very important. We're going to be looking again at how we can get that data to parents, to get to the parents in a way that they'll read it and understand the value and importance of it. We do have in California something that is mandated. It's a school report card where a lot of data is shared in terms of the school's academic performance. I'm going to check in terms of the very point you raised, how many of these other health and social services kind of indices could also be added to that report card so it would be more available. And we just had a discussion the other day at the State Board of Education is how can we make this card, this notice to parents about the quality of their school and what's going on with the student population, how can we make it more meaningful and read in greater detail by the parents?
Tim, do you have a question?
Yeah, one of the things that I wanted to raise, we talked about the high-level policy folks getting together and thinking together, breaking down silos and so on. I think we've also talked about how Healthy Start used to do some stuff, still does some stuff on the ground, community by community, school by school. What we haven't talked about is the middle management, the bureaucracy, and how you move these large bureaucracies to actually follow the model that is maybe evolving at the top or even at the bottom, and wanted to get some comments on that.
I think some of that comes from the top. I mean, one thing that I loved about Dick Riley when he was secretary, I keep going back to him because we always said we worked for a saint, but he was really dedicated to this, and he used to say, you're the cage rattlers and barrier busters. If every agency had said that to everybody that worked for them, and the task was, we're going to make this work. Lots of times, as you know, there seems to be a lot of fear that, oh dear, we'll let somebody do something and it won't be according to the rules, and then what? There's got to be a change in the culture, and I think there's also got to be a streamlining of decision-making. We spend a lot of time in my office fighting, arm wrestling with middle management bureaucracy in the state of California. And there's somebody here from one of my schools right now who knows what I mean. Just trying to, oh, that wasn't you, Jody. No, I was thinking of Ron Mooney. But we do this a lot. And it's a corporate culture, and it's got to change. And I think whenever we get federal dollars, we should pass it through to the ground level as fast as possible. So.
If I can add to that, in the Department of Education, just an example, 2,500 employees, $60 billion of program dollars coming through that we're responsible for auditing and programming and distributing. But a lot of mid-level and front-line level employees, consultants in the department had not been asked for years. Well, what's your idea to how to serve the schools better and to serve students better? And you check off that the money was spent, but did you check off, was the money spent well in any particular program? So I think having that, we did a whole strategic planning process in the department, and interviews with a couple hundred of the people who volunteered for a good hour and a half kind of interview to really search for our mission and search for empowering individuals at all levels to feel they had a say and they could express the need for change or a smart idea they had. One other thing I'll say that we should do, and I think I'm focusing on the teacher training. You know, how do teachers get their training? How do they come into the profession? We should also do it for social workers. But principals who get their credential and teachers who get their credential, it should be part of the teacher training program to have this kind of integrated thinking and to have, you know, lessons and ideas. So they come to the profession at all levels, whether it's mid-management, you know, second-year teacher, third-year, you know, school principal. They come with that idea that there's opportunities if you link arms with the other agencies.
Thank you.
One other thing I would just say very quickly is that how we pay people matters. And when I worked in the public health department, you know, how people got reimbursed was about essentially having to prove that they had essentially provided X number of services. There was no question or inquiry about how those services were provided, who participated in collaborating to provide those services, where were they provided. And so the things that mattered weren't, you know, the systems weren't held accountable for. And I think that there's a lot of work that can be done just looking at essentially the deliverables in all of these contracts and essentially forcing people to essentially to collaborate in providing those outcomes for which they get paid.
So I am going to have to end it there. Marty tells me that we are out of time. And I want to give a huge thank you to our panelists for being here today.